Hello guys, welcome to my channel. In this presentation I'll be discussing mental retardation, and I'll be focusing on a particular question that was given to me by one of the students. And this is the question. The stem of the question reads: Mrs. Katebe reports to you that their 9-year boy has difficulties in learning, and that the boy delayed in walking and talking. Upon assessment, you suspect the child has mental retardation. So I'll be responding to this question. This is the question I'll be answering. Part C. Discuss the management of mental retardation in terms of primary prevention, secondary prevention, and tertiary prevention. There's something I need you to note down on this one. This management is not specifically focusing on this 9-year-old boy. Okay, this question is open. Mental retardation. How can you manage mental retardation? It's not saying how can you manage Mrs. Katebe's boy. No. So it's an open question about mental retardation, how you can manage it both primary prevention, secondary prevention, and tertiary prevention. So it's an open question. So in this case we are going to have 10 marks each because we have 3 parts that we are focusing on. This is a simple question that shouldn't give you trouble, ladies and gentlemen. Okay, so let's see how we can answer this question. So for all your managements, you need to begin with your aims. You need to tell us what exactly you'll be what exactly is your goal for your management. So in this case we have 3 parts that we are focusing on: primary, secondary, and tertiary. We need to know what you'll be doing. What will you be doing under primary? What's your goal under primary? So for primary prevention, we are focusing on individuals who are at high risk of becoming mentally retarded. Most of the time it's the unborn child. Okay, so our aim for primary prevention is to prevent mental retardation. Then for secondary prevention, we are providing treatment to the child or the client who has been diagnosed with mental retardation. So our main aim for secondary prevention is to prevent complications. Under tertiary prevention, we are trying to make this person who has mental retardation to live a positive life, and so that they are not dependent on other people. Okay, so under tertiary prevention, we are providing rehabilitation, so to rehabilitate the patient. Let's see under tertiary prevention. So let's see some of the aims I put down here. So we have to prevent mental retardation in the newborn, to promote good mental health status, to prevent complications. So 3 aims are enough to get you the 2 marks that you deserve. Okay, the 2 marks that's allocated to aims most of the times. Alright, so let's see what next we need to talk about. So under primary prevention, there are certain points that we need to talk about. There are certain things that you need to focus on. Remember I said primary prevention focuses on the person who is at high risk of becoming mentally retarded, and in this case we have the unborn child. So before pregnancy, this is the time when the couple has not yet decided to conceive. So they will be coming to the health facility for certain services, for family planning services and all that. So before the woman conceives, they have to receive counseling, family planning counseling. They have to receive help from the health facility. So what will you be doing? What interventions will you put in place before pregnancy? So I've listed down these 4 points, ladies and gentlemen, to just guide me on what I should be talking about in my management. If you want, you can write them as your subheadings. If you want, you can just leave them out. Just write primary prevention and write your interventions under primary prevention. So these 4 points are just guiding me what I should be talking about under primary prevention. Okay, so during pregnancy also what will I be doing now? This is during antenatal care. What will I be doing for this woman to prevent mental retardation? During childbirth, this is during labor. In labor, what will be my role also to prevent mental retardation? After childbirth, when the child is born, what will be your roles to prevent mental retardation? So that's what we are discussing now. So let's see what you need to talk about before pregnancy, during childbirth, and after childbirth. So before pregnancy, there are certain points, there are certain things that you need to do, there are certain activities that you need to carry out as a nurse. Family planning services. Before the couple gets pregnant, of course, they may be coming to the health facility to seek help, and they may also be coming for family planning services. So you need to be able to make these family planning services available as a nurse. Okay, and during these family planning services, you need to encourage child spacing. Family planning plays a big role in preventing mental retardation. We know that malnourishment is one of the causes of mental retardation. And if the family is too big, the couple has too many babies, it's going to be difficult to fend for all of them. Okay, so to prevent malnutrition, to prevent poverty in this family, you encourage child spacing. Alright, so that the children may be given the best life by their parents, because they can at least afford a small family. So encourage child spacing, alright, before pregnancy. And also before pregnancy, there are certain vaccines, there are certain medications that women take. Okay, such as tetanus vaccines. Women usually are given these tetanus vaccines. You need to encourage a woman to take these vaccines. Okay, also there is these points that I've listed here. Encourage genetic tests to rule out any genetic deformities. Encourage couples to take genetic tests to rule out any conditions that may make them conceive a child who may suffer from mental retardation. Okay, there are certain genetic conditions that you do not want, that may put the couple at risk of having at a higher risk of having a retarded child. So if they take these tests, they may make an informed decision whether to conceive or not. If they conceive, at least they will have gotten the information, the message from you, a healthcare provider, because you told them already about the consequences of conceiving. Lifestyle changes in preparation for pregnancy, such as avoiding drug and alcohol abuse and other high risk activities. It's very important that this happens when the couple has not yet decided to conceive, or has decided to conceive now and they want to be off family planning. You need to discourage any abuse of alcohol and other drugs, okay, and other high risk activities that a woman may be involving herself in, or the couple may be involving themselves in, so that they protect their child. Okay, so we know alcohol may cause fetal alcohol syndrome, which may lead to mental retardation in a child, so you don't want this to happen. Encourage early antenatal booking also. Before they become pregnant, you can tell them about antenatal booking, and that in case they suspect that they have conceived, they need to come for antenatal care services early so that they are examined and booked in case they have indeed conceived. Alright, so encourage early antenatal booking. During antenatal care services, we provide a lot of services that the woman that will help prevent. So during pregnancy, we are going to be carrying out our activities during antenatal care services. Okay, so this is the time when the woman has conceived, when the couple have conceived. So we are going to focus on the following: encourage consistency and dedication to antenatal care. Make sure that they are dedicated to antenatal care, because during antenatal care services we provide services that may help this woman and her husband in how they should conduct themselves and protect their unborn child from being born retarded. uh, Assess the woman for any STDs and any STDs such as syphilis, and treat the condition accordingly. So there are other STDs that you need to treat to make sure that the child is not affected, because these conditions have a potential of causing mental retardation in the unborn child. Also administer all necessary vaccines and prophylactic medications to protect the unborn child. Alright, so whatever medications that you need to give, vaccinations you need to give to a woman during pregnancy, you need to give them. You need to administer these medications so that the child is not affected by whatever conditions that this woman may suffer from. Administer folic acid to prevent spinal bifida. This is one of the prophylactic drugs that we give to a woman in labor or in pregnancy, during pregnancy. So we make sure that we give them folic acid. Folic acid prevents spinal bifida, and this may lead to mental retardation as well in a child. So yeah. Encourage the woman to avoid any activities that may cause trauma to the unborn child. Any activities, fighting, or being involved in very strenuous activities, she has to avoid such activities so that she does not put her child at risk or in danger of trauma, because trauma may lead to mental retardation as well. Encourage health diets. Make sure that she is feeding healthy, taking enough proteins and carbohydrates as well, so that the child is born, the child's brain grows as it is supposed to grow. Okay, so health diet, you encourage a health diet so that the child is not malnourished also, and also to prevent unnecessary conditions that arise um, due to poor feeding. So this will also prevent mental retardation in a child. Also, make sure that you remind the woman to avoid taking alcohol and self-prescription drugs, self-prescribed medications, because these may cause brain injury to the unborn child. Okay, so there are other activities that you can put up during pregnancy and discuss them nicely. And remember, ladies and gentlemen, that when you are writing your management, you always have to do with I will, begin with I will. So rewrite these points beginning with I will. Okay, you rewrite these points beginning with I will, and you will get your full marks. Okay, so during childbirth, There are also some activities that we need to carry out, such as follows. Make sure the woman in labor is attended to by a professional midwife or any skilled person. Okay, so avoid using traditional birth attendants because they may not have the knowledge of what is going on, and that may lead to mental retardation sometimes, especially if they cause injury to the brain of the child. So make sure a skilled person, a professional midwife, is attending to a woman in labor, especially when you have cases, special cases. Make sure that those cases are attended to by specialists. Okay. Then perform proper assessment of the woman to rule out any complicated labor on time, such as cephalopelvic disproportion, prolonged labor. You need to make sure that such complications are ruled out during labor. So another assessment to establish whether this woman may go through normal labor or a complicated labor process is done during antenatal care services. During labor, you can also continue assessing the woman to just make sure that the progress of labor is normal. Otherwise, if you observe any changes that you cannot manage to handle at that facility because you have limited resources or manpower, you have to make sure you refer that woman quickly. Okay, each hospital, each facility has got a policy on how you need to refer such cases to other advanced facilities. So yes, this is one of the things that you can do, and also manage or refer any complications on time to prevent fetal injury. Any complications that you rule out during your assessments when a woman is in labor, if you can't handle that situation, you need to refer it to a more advanced facility. Prevent asphyxia and fetal distress. Okay, you need to make sure that the woman is okay and the fetus is okay, making sure that the fetus does not go into fetal distress. Okay, and also perform resuscitation on time in case uh, the child is born with asphyxia. You have to make sure that you resuscitate the child on time, so that they do not suffer from brain damage, which may lead to mental retardation. Okay, so these are some of the activities that you can carry out during childbirth or during labor. Okay, so after childbirth, when the child is born, there are also certain activities that we carry out under primary prevention. Educate the mother about the importance of observing feeding plans to prevent malnutrition. The child must be fed. If the child is breastfeeding, the child must be exclusively breastfed up to 6 months, and the intervals at which the woman must be breastfeeding the baby. Okay, so that the child is not malnourished, because malnourishment may lead to mental retardation as well. Teach new mothers how to handle and take care of the baby to prevent avoidable traumas to the baby. Right, so new parents may not know how to handle the newborn child, so they have to be taught such skills of handling a child to avoid traumas to the child's brain. Okay, to avoid accidents that may occur as a result of not knowing how to handle a newborn child. So give them such parenting skills, okay, before you let them go home. Also encourage the mother to get help when stressed. When the woman feels stressed, you need to encourage her to always get help. She may come back to the health facility for counseling, or she may find someone close by or ask for help from the husband or anyone. Okay, this is during after giving birth. It's very important to avoid to prevent herself from being stressed. When the woman is stressed, she may put her child at risk of injury. Okay, it can be negligence. She stops breastfeeding her, or she may be aggressive towards the child. She may be violent towards the child, and may cause physical injuries to the child, which may lead to brain damage as well. So encourage the woman to get help when she is stressed. Offer vaccinations for the children, for the child, against measles, polio, influenza, and other infections, as these conditions may lead to mental retardation. Okay, so vaccinate the child at specific time intervals. Okay, you give them the vaccines that they are supposed to receive. Alright, this may help prevent mental retardation as well. Recommend a healthy diet to maintain adequate vitamin intake, reduce obesity, and lessen the risk of vascular diseases. It's very important that you do this so that the woman is feeding well, that she can produce healthy milk for the baby as well. Okay. Under secondary prevention, this is another part that we need to talk about, the second part that we need to talk about now. So under secondary prevention, remember, we are focusing on early diagnosis and early treatment of mental retardation. So for you to establish an early diagnosis, you need to put in certain interventions. Okay, and these are some of the things that you can do. Teaching parents developmental milestones of a child to help detect any abnormalities early that may indicate mental retardation. We know that a child is supposed to start sitting at a certain age, supposed to start crawling, walking, talking, and running at different stages of life. So if the child is not achieving or skipped certain or delayed in achieving such milestones, it must be a warning sign of mental retardation. Okay, so you need to educate the woman about these milestones and when they expect to see them. If they delay, the woman must report to the health facility so that the child can receive early treatment. Okay. Educate parents on signs of mental retardation. They have to know what are the other signs of mental retardation apart from delaying or not achieving these developmental milestones, so that they report such signs to the health facility on time. Okay, for early intervention. Initiate early treatment for any identified conditions. Okay, so treatment must be initiated on time for any conditions that you diagnose in any child. Okay, also emphasize on the importance for treatment compliance for those children that have been diagnosed with mental retardation. It's usually a long process of treatment that they will go through. So depending on the cause that you may have identified, you are going to prescribe treatment to the parents. Sometimes the parents just have to take their child to, or link their child to a special school where the child will learn skills on how to handle, on how to manage her life and to avoid being dependent in adulthood, being dependent in their adulthood. So emphasize on the importance for treatment compliance, all right, so that they will not escape uh, any appointments, and they'll make sure that the child receives the prescribed treatment. Conduct assessments through OPD and under 5 clinics for early diagnosis. So the children that you attend to in the OPD section, you need to screen them as well to um, for signs of mental retardation, for any retardation, so that you can put them on treatment on time. Okay, and during under 5 clinics, you can also you can also carry out such assessments. For children diagnosed with mental retardation, attach them to special schools early for them to learn life skills and promote independence. Okay, so make sure that you attach these children early to their special schools when you identify that they are suffering from mental retardation, so that they will learn some skills as well, life skills on how to survive in society. Refer any identified cases for specialized interventions, cases that you may not handle and you feel these need specialist intervention. You have to refer also. It's your role, ladies and gentlemen, also to make sure that you refer cases that you cannot handle. Okay, so yeah, it's part of treatment. Provide necessary support to parents with a child diagnosed with mental retardation for ultimate healing of the child. Being or receiving news that your child is retarded is one of the most heartbreaking news that a parent can receive, and the parent may suffer from depression, may end up being stressed, and sometimes, if not well informed, the parents will actually end up abusing their child without them knowing. Okay, they will end up isolating the child. Some may end up neglecting the child, not attending to him or her, and some may end up being angry towards the child and angry towards themselves, and they may be physically aggressive towards the child. Okay, so they really need to be supported so much so that they they do not become a danger to the child, to their own child themselves. Okay, so this is under secondary prevention. So just think of whatever activities that will help. You can be counseling, you can include it here under secondary prevention. Counseling services to the parents, counseling services to the child, you can include them here. So any activities that are focusing on early diagnosis and initiation on treatment, you can include them here. Okay, and treatments, you can include them under secondary prevention. So remember to write these statements beginning with I will, okay, as you respond to such a question. The other part of mental retardation, management of mental retardation, is tertiary prevention. Under tertiary prevention, we said we are focusing on rehabilitation. So we are rehabilitating this child at this stage. We need to consider in what area an individual or a client can be rehabilitated at the time of initial diagnosis and upon recovery. So you need to identify the deficit that this person has when you make your diagnosis, and when they have recovered. Okay, so we need to in this case, when we find out in what area they need help, it's going to be easy for us to rehabilitate them. Okay, these areas of need could be that the person is lacking in their social life, social interaction, their social skills. So you are going to train them in that area. Okay, it could be that their interpersonal interaction is also altered. You have to rehabilitate them in that area. Their self-esteem is distorted. You have to also rehabilitate them in that area. Teaching the patient daily living skills to prevent dependence also. So under tertiary prevention, some of the activities that you carried out under secondary, they may also continue under tertiary prevention. So you need to teach the patient some daily living skills to prevent dependence. Also, social skills training to promote good social abilities. We need to include this as well. We know these patients, sometimes their social life is very distorted. That's why some of the people, they just run away from them. They don't want to be close to them. They don't want to socialize with them because of their distorted way of interacting with people, because sometimes they may have some violent episodes against those they are interacting with. Assertiveness training to promote self-esteem in a client. Sometimes these patients suffer a lot of stigmatization and discrimination, and we don't want that to happen to our clients. So we need to train the clients to be assertive so that they have that self-esteem to defend themselves against any form of injustice or mistreatment. Refer clients to occupational training centers to acquire a survival skill to fend for himself. So those clients that may learn a skill, we can always refer. So those clients that you feel they can learn a skill, you can always refer them to these occupational training centers to go and acquire a skill. These skills could be carpentry, welding, it can be any other skill that will help them fend for themselves. Yes. So mental retardation is in stages. We know there's mild, moderate, severe, and profound mental retardation. So depending on what level of mental retardation, depending on the level of mental retardation, some clients may actually learn a lot of things. They may learn to do things on their own. So yeah, after carrying out your assessment, you will tell that this person is capable of learning a skill. So you refer them through the social welfare. They can be attached to such institutions that can train them. Okay. Teach the client anger management techniques as well. So anger management techniques, we know these clients may have anger, may have violent episodes. We have to help the patient, we have to help the client to be able to manage their anger, okay, without directing it towards anyone. So this may help in encouraging or promoting that interpersonal interaction between uh, uh, with other people. Okay, so yes, we need to teach the client anger management techniques. Referring clients to various aftercare services after discharge. We can also refer the patient to other institutions that may continue helping the patient um, after you have discharged them from your ward. So yes, you can attach the client to the pastor in their community, or you can refer them to a community mental health volunteer. You can attach them to their nearest health facility. You can attach them to the aftercare homes where they will receive they'll continue receiving help from when they have been discharged. Okay, it's very important as well. So, in cases of severe and profound retardation, we know such clients are completely dependent on other people to take care of them, for them to meet their daily needs. So, encourage parents to be available for the patient or find a trusted caretaker to help the patient throughout the day, okay, in meeting their daily needs or activities of daily living. It's very important that we do so for such uh, for these clients with these types of mental retardation. Involve the patient in activities that interest him, such as painting. There are certain patients who are who have there are certain patients who may need who may show interest in certain activities. So you need to help them. You need to provide them with what they need to paint. You need to provide them, or to just make that activity available for them, so that they'll keep themselves busy. They'll be playing with whatever they like to play with, and their life goes on. Okay. Encourage parents to be patient and loving to the child, to prevent child abuse as well, and for the child to feel loved. Okay, so this can also be helpful, so that parents do not become abusers themselves towards their own child. Okay, because these children, parents with this kind of children are at highest risk of becoming abusers themselves. So they really have to be counseled, they really have to be trained and encouraged to be loving uh, and caring towards the child. All right, so this is what I had for you, ladies and gentlemen. Thank you so much for watching this presentation. If you are new on my channel, please remember to subscribe.